Hello, everyone. So, I hope you're having a fantastic Wednesday. I am. So, today I want to talk to you about, are antibiotics good for you? And when should you take it? When shouldn't you take it? And what can you do if you shouldn't be taking antibiotics? And what are the times that it is beneficial? So, this is such an important thing because I've been seeing more and more and more people who have been affected from taking way too many antibiotics way too frequently and for things that are not even necessary. So that's the reason why I really thought this was a topic that I wanted to bring to you, and I hope it helps someone to make better decisions rather than just trusting a ER or an urgent care doctor, because many times that's what happens. People actually, even many times pediatricians and PCPs, they actually prescribe way too many antibiotics. So when is it actually useful? First, let me talk about that. It's useful in case of emergencies. Like, I mean to say serious emergencies where if you don't take it, it can contribute to sepsis and even the death of the person if nothing is done. So that's when it is really necessary. So where something has burst inside the body, or it is actually super swollen that it's possible that it can burst, or that the infection has been there for way too long and it has led to sepsis. In all of those reasons, or in case of any kind of infection from injury that hasn't been treated properly and it is really a life or death, in all of those things, antibiotics are wonderful. You absolutely must take it at that point in time because it can save lives. Okay, like gunshot wounds and all of those cases, it's fantastic because it has saved so many lives. So I'm not really against using antibiotics in those kinds of places. But now we have so many different reasons why we use antibiotics, especially very early in life. In babies, antibiotics are given out like candies, and that I'm not okay with. And why am I not okay with that? Because there have been so many studies, and not something that I tell you, but there have been studies over and over and over again that have been done on antibiotics and the usage of antibiotics amongst young children, and how it affects their gut flora, how it can actually cause eczema, how it can cause asthma, how it can cause even issues like depression amongst people that are teenagers and older people. It can cause obesity. It can actually predispose us to type 2 diabetes, and so on and so forth. And even so, I've been seeing patients with food allergies which are caused by antibiotics, the overusage of it. And many patients that come to me, kids especially, have been on so many courses of antibiotics before the age of 5. It's unbelievable. And what they end up with is either eczema, food allergies, or asthma, or all of the above. And so what can you do to prevent this from happening? You need to empower yourself. That's what you need to do. So if you go to the paradigm which offers antibiotics, then that's what you're going to get, because there is no other way around it, right? If I know only antibiotics, then I can only prescribe you antibiotics. If I only know differently, I can treat you differently. So it's your job to start taking control of your health. Okay, and we have for you free resources on our website to start treating ear infections, strep throat, colds, sinus infections naturally, completely naturally. And when you do that, that should be your first resort. That's the first thing that you should do. Absolutely. There's no questions about it. And only if all of those fails, then you should actually really try to, schedule an appointment with a doctor like me, who can help you with treatment. Sometimes maybe the natural treatments that are online may not fit you. Maybe you need something more customized for you. Then do that. And if that is not really working, that's when you go to antibiotics. So if you have tried all of those things, that should not be the first resort. I've treated mastitis and strep throat and every kind of infection that you can imagine, in everything naturally without the need of antibiotics. And we have even used it for people post-surgically. We have a whole post-surgical protocol that we have put together that we give people so that they don't have to take antibiotics, because I really see how many different problems that we are creating by the usage of antibiotics in the way that we are using it currently. And not to mention that, we already have antibiotics in many of our city water. And on top of it, chlorine that is added to the water acts as an antibiotic as well. So most people already don't have the right kind of flora in their gut to begin with. And this is the reason why probiotics are so necessary these days. Like, so many people have to keep taking probiotics on a regular basis. Why? Because either we drink water that have antibiotics in them, like chlorine, or we take antibiotics so easily. And did you know that it's going to take 2 years, up to 2 years, for your gut to repair itself and heal from one course of antibiotics? So if a child takes antibiotics maybe 3 or 4 courses in a year, I can't even imagine what that gut flora is. And obviously the other problems follow immediately. And another aspect of it is that, so many people, for acne and things like that, they put people on antibiotics for even up to 6 months. You have no idea how horrible that is for you. So before you go to any of those things, and if these are not sufficient, our free resources are not sufficient, then go do the naturopathic medicine course that I've offered. We'll have the link there. And also I have references for everything that I'm talking about, how antibiotics contributes to eczema and asthma and all of these things. I have references here. The reason why is I want you to know, I want you to get educated so you can make better choices, because I'm always a big believer of when you know better, you do better. So know better so you can do better. So our naturopathic medicine course is something that you can join as well, and it'll teach you what your body is trying to tell you and learn what is the cause of the problem rather than try to mask the problem. Learn what it means. What is your body trying to tell you? The more you learn what your body is trying to tell you, the more you address the cause of the problem, the more you will actually be healthy. And the good news about it is that when you treat yourself naturally without the need for antibiotics, what you're also doing is you are teaching your immune system to do better on its own more and more rather than killing things. And that is going to prevent you from getting sick more often. So one of the things that people say is, they come to me because their kid maybe gets sick often and they don't want them to get sick often. But all we have to do is just treat them. And when we treat them every time when they get sick naturally, they'll stop becoming as sick because their immune system is learning and their immune system is becoming strong, and their immune system doesn't really succumb to every virus and bacteria out there. And that is the way to do it. When you do antibiotics, you are literally killing off the good flora as well, which means that even if you take a probiotic, it is still not going to equal the amount of flora that you had prior to you taking antibiotics. So which means that your body is going to take time to recuperate. And the types and diversity of the strain that we have in our gut is truly our strength. It protects us, it strengthens our immune system, it helps our digestive system. So it does so much. And taking antibiotics also affects your digestion, not only your immune system, but also affects your digestion. And that's the reason why food allergies are rampant these days. People cannot even digest normal foods anymore because their gut flora is not good. And I treat it by healing the gut, by putting the microbiome back in the gut. So if you prevent it from happening in the first place, we don't have to treat it, because I truly believe that the best treatment out there is prevention. And that's the reason why I do these things, So, watch all of the videos that I actually share, because I'm always trying to educate you so you don't need to end up in my office. So if you don't want to come see me in the office, learn, get yourself empowered, put them in practice, and you will see the benefits of it. And the more and more and more you see the benefits of it, the more you will apply yourself. And the more you apply yourself, your health will be better and you wouldn't need me. Okay, so thank you for joining me today. I'll see you next time.